can see that, Allison?
Yes.
Excellent. Well, welcome everybody, and thank you so much for joining us today. We're heading into the home stretch of open enrollment for the health insurance marketplace, and we're really excited to talk today about the enrollment deadline, what coverage means for folks here in Missoula County and across Montana, and also discuss some of the information and resources available to help our neighbors and communities understand their health insurance coverage options. So I'm Olivia Riutta. I'm with Cover Montana, and Cover Montana is a project of the Montana Primary Care Association, and we have partners in Cover Montana across the state. We're a Montana-based website where we provide information about coverage options and connect folks who have questions with someone who can help. We also provide training and technical assistance. And we've been fortunate enough to be doing this work since the very first open enrollment period back in 2013. So we have a couple slides and I'll share them in the beginning, and then we can also share them with anybody who wants a copy of them today. So first of all, we're going to be discussing some new data points on uninsured numbers in the state of Montana. The Montana Healthcare Foundation recently released this report that updates our uninsured rate and projects some of the impacts of the COVID-19 pandemic. And we'll be sharing a few charts that are from this report, but you can see the URL right there to also access it. So that is what the report looks like. So just a couple things to kind of set the stage, just to remind folks, this is just a pie chart that outlines how Montanans get their health insurance coverage. And so the majority of folks, as you can see from here, are either getting their coverage through an employer, through Medicare, which is a public plan for folks who are seniors or have a disability, and then through Medicaid, which is a public plan for folks who are low income. About 5% are buying plans on the individual market, and that's mostly on the health insurance marketplace. And about 10% of Montanans are uninsured. So the number of Montanans getting their coverage through the marketplace is small compared to some of these other ways that folks get coverage, but it's a really essential tool for people who don't have the option to get employer-sponsored coverage, don't qualify for Medicaid or the marketplace. And it's especially important this year as so many people's employer-sponsored coverage has been potentially impacted by COVID. So I'm gonna stop sharing my slide. So we are heading into this open enrollment period. Cover Montana and healthcare providers across the state received grant funding from Montana Department of Public Health and Human Services to ensure that we have the capacity to reach and enroll our communities in these really unprecedented times. So here in Missoula, we're fortunate because we have 4 grantees, and representatives from 3 of those organizations are joining us today. But first, I want to hand this virtual podium off to Missoula County Commissioner Josh Slotnick.
Thanks a lot, Olivia, and thank you everybody for attending, and thanks for inviting me. I just have a tiny bit to say, kind of almost like a PSA here. As Olivia said, I just want to wave this banner loud and remind all who might be listening. Open enrollment is on, and it closes December 15th. So we're in a critical time right now. We want to make sure that everyone who needs health insurance gets health insurance, that everyone in Montana is covered. This year especially, as Olivia pointed out, due to the pandemic, so many people lost their jobs. And as you saw in Olivia's pie chart, most people get their health insurance through their job. So when their job goes away, they are left to their own designs. Well, the idea here is to tell people you are not all alone in this, that there is the marketplace, and you have till December 15th. And as you saw in Olivia's pie chart, there are a chunk of people who are uninsured. And my guess is people are uninsured because they expect that if they go onto the marketplace, it's just going to cost too much and it isn't worth their time. Well, I want to pass on to you that 9 out of 10 Montanans qualify for a tax credit, which reduces how much you pay in total. And nearly 1/3 of Montanans who apply qualify for cost share reduction. So that's money right away reduced from how much you have to pay. We're facing an uninsured rate of nearly 11%. 11% of our fellow Montanans don't have insurance, and it doesn't have to be this way. If you don't qualify for a federal program, you don't get health insurance from your employer, you can still get health insurance. You have till December 15th. Jump on it, enroll, and we have people locally who can answer questions all over the state, but here in Missoula for sure. There you go. Get it done. Thanks for having me, Olivia.
Thanks, Commissioner Slotnick. We appreciate it. Next, I want to introduce Dr. Jim Quirk, who's the Chief Medical Officer at Partnership Health Center here in Missoula. Dr. Quirk.
Hi, can you guys hear me okay? Yes, good. So my name is Dr. James Quirk, as highlighted. I'm the Chief Medical Officer at Partnership Health Center. And I was asked to kind of explain, who we are, what we do. We are a clinic in town. We are a federally qualified health center. We see about 16,000 patients, or overall, we have that many unique users. Because we're federal, we do get a little help in regards to the services we provide. And, with that in mind, we'll work with anybody in regards to their need for medical care. We offer medical, dental, pharmacy, behavioral health, and integrated behavioral health all on site. So to Commissioner Slotnick's point, there's always options. A lot of the barriers that people have to access care vanish when they reach out and they ask a few questions and try and let us help them. We do offer a sliding scale, and that is great, and we're able to do that. But that is unique to Partnership. And when people utilize the sliding scale, we can offer everything we can offer under our roof. But if they go out to the community and they require x-rays or labs, that no longer qualifies in that setting. And as a result, the help that we can offer, given our special status, kind of goes away at that point. And we want to make sure, why are we here? On a day-to-day basis, we see people whom are hugely impacted in their need for insurance. If they get an illness that's scary, cancer or some other significant illness that causes them to seek medical care, they shouldn't be worried about how to pay for it, or if they're going to go bankrupt, which happens as a direct result of the medical costs associated with their care. And that is something that we see not infrequently. And it's a struggle that we would love to alleviate in any way we can. Part of what I was asked to do was to share an anecdote about what we have available or a unique circumstance in our setting. And I would just say it's kind of all around us. It's every day. I do want to highlight one person, the person who basically helps with this enrollment process. Jenna Buska is our Director of Patient Services. And I was going to kind of let her speak to what I thought was a really cool sort of interaction she had recently.
Hi, everybody. Can you hear me okay? Thank you, Dr. Quirk. So I shared a story. I was on the front desk about a month ago. I had a gentleman come in to pay his bill. He had about $800 in cash ready to hand it over to me. In talking with him and looking into his information, I realized that he was uninsured and he was not on our sliding fee scale. I was able to get him set up with the sliding fee scale right away and bring his amount back quite a bit. As we were doing that, he shared with me that he was living with a friend outside of town and was about to get kicked out of that situation. So I got him connected with a social worker to see if we could explore some of his housing options here. We also got him covered by Healthcare for the Homeless grant funds to cover him for about 3 months while he was looking for housing. And we got him connected with the CAC to help him apply for Medicaid. He also told me that he was having trouble getting his medications, and so we got him his meds. We got him back on his meds, and we got him an appointment with his doctor. So, all of this took about an hour, but it was an hour well spent, and I just feel lucky to work at Partnership where we can do all of those things at once.
Thank you. And I'll kind of hop back on here. you know, being able to do this here in the partnership and in any setting is a gift, and we appreciate it tremendously. And we don't want people to go without insurance. There are multiple avenues at which we could help them out in that regard. And we strongly encourage people to access open enrollment in the exchange, and you know, let us then take care of them and make sure that we have the opportunity to do so that in a way that's not stressing them out financially. With that, I think I'm going to hand it back to Olivia.
Great, thanks, Dr. Quirk. So next, I'm going to introduce Laura Byrd. Laura is an enrollment specialist at All Nations Health Center.
Hi, can you guys hear me okay? My name is Laura Byrd. I'm the eligibility specialist at All Nations Health Center, and we are an integrated healthcare center that provides a comprehensive suite of medical services, which includes medical, behavioral, and community health. All Nations is committed to providing sustainable, healthy lives for our Native people and the surrounding community through culturally based holistic care. It is open enrollment, and we want to remind folks that local help is available from folks like me across Montana. I am a certified applications counselor, and I assist individuals in choosing the healthcare option that is right for them. I determine their eligibility based on certain factors, such as household size, income, age, and then depending on their situation, we do either a Medicaid ACA marketplace application or we look into Medicare options. I answer questions, I explain the basics of coverage, I walk them through the application, and I help provide information so they can pick a plan that works best for them. And I also make sure they understand their coverage, such as explain what a deductible is, coinsurance, and the importance of picking an in-network provider, just to name a few. And I also review the application with them, and I help troubleshoot when questions arise. And my help is always free and confidential. And when working with folks who need coverage, cost is always a big consideration as they pick a plan. The good news is that most Montanans who enroll in coverage through the health insurance marketplace qualify for financial help. 89%, almost 9 out of 10 Montanans qualify for financial help to make their monthly premium more affordable. Native Americans also have special provisions available to them through the ACA marketplace. Enrolled members of federally recognized tribes that are below 400% of the federal poverty level are eligible for either a $0 plan where there are no out-of-pocket costs, or a plan with limited cost sharing, and they are also eligible for a special enrollment period to receive coverage year-round on the marketplace. And we will have a visual of that chart to just demonstrate the federal poverty levels at the end. But I also get asked by our patients and our community, why do I need health insurance if I have IHS or can go to All Nations? Indian Health Service is not an insurance plan and does not provide comprehensive coverage. The same goes for our services at our clinic. Insurance allows Natives to access the care they need at the provider they choose, and it provides peace of mind, which is especially important right now. And using insurance at IHS or an urban program like All Nations allows us to expand the services we can provide our community. I truly enjoy my job and being able to connect individuals with health coverage. The majority of my appointments and with clients who are relieved, happy, and thankful that I am able to help them navigate these applications and answer any confusing questions that come up. Today, I connected with a client who recently lost her job and employer coverage, and we did a Medicaid application, and she was very relieved to know she had health coverage going forward. So, thank you very much.
Thanks, Laura. Finally, I want to introduce Kirk Bodlovic, Chief Operating Officer at Providence St. Patrick Hospital. Hopefully I got it right, Kirk.
Yeah, that was perfect. Thanks, Olivia. So, while you have some, Laura, thanks for that information. For sure, we have also at Providence some certified application specialists that have been in place since this program opened in 2013. And just the idea that you could contact someone like Laura or somebody at Providence and have those sort of answers addressed for you and help walk you through that is such a huge benefit. I mean, I can just envision myself in a position like that as somebody in this community without insurance and needing that help. Just that sort of guiding hand would be obviously a huge benefit. So certainly thankful to folks that are in helping us in that position. And it's pretty obvious to say that somebody having insurance provides some benefit and peace of mind. I think about sort of what people must be going through now. We saw those numbers with regard to the number of folks that are currently uninsured, and I'm not sure what the numbers are going to look like post pandemic or what it'll look like even next year with the number of folks that potentially lose jobs. But it's needless to say, it's vitally important for our community that folks have insurance either through the marketplace, through their employer, or through Medicaid expansion. I mean, I look at those numbers from in terms of that pie chart at the beginning, and I remember back pre-Medicaid expansion that 9% of the folks that we took care of were uninsured and had no access to coverage. And so Medicaid expansion and enrollment in the marketplace has just changed those numbers significantly. And today we see about 2% uninsured since Medicaid expansion went in. And so, and for whatever reason, there's a 2% that can't get coverage. Maybe they haven't walked through the process with somebody like Laura to see if they actually qualify, you know. So, but anyway, I just want to say it's obviously an important part of the safety net of this community. It helps preserve the services of these great organizations. You know, the Partnership Health, we do a lot with Partnership Health. It's a great partner, as is All Nations. DeShane is on our board here at St. Pat's, so we have a good relationship there. And so I think that it's, you know, the larger community, it does a really good job of caring for the members of this community. And so these services are so important, and having insurance just, I think, number one, is puts people's probably their hearts and minds at peace, knowing that they're covered and they're not afraid to delay care for any reason, knowing that they've got insurance and can come in and be seen. So I think those are my big talking points. I'm happy to try to answer any questions folks might have. I know that anecdotally, folks that contact our application specialists year after year like telling their stories, potentially if they had a big surgery and what a relief it was to have had coverage. So I think that folks have developed relationships, and I would just say, you know, to the community to make sure that you reach out, whether to Providence or to Laura at All Nations, and make sure you walk through that process, and you'll probably find a really friendly voice on the other end of that line.
Great, thanks, Kirk. I count myself lucky at Cover Montana that I have had the opportunity to work with enrollment assistors at all of the organizations here in Missoula and across the state. And these are folks who are dedicated to the role that they play and really will do anything to kind of help their patients and clients and community figure out what coverage options they have and support them through that process. So I have a couple, I'm going to pull up a couple more slides. Bear with me. Let's see. Okay. Can you see, you can see that? Yes. Okay, excellent. So I just wanted to, so we have a couple of slides that we'll send out to folks. These are some of the charts from the uninsured report, really kind of looking at how our uninsured rate in Montana has changed over time, pre-Affordable Care Act, post-Medicaid expansion, and now as it is ticking up and we are heading into kind of the impacts of the COVID-19 pandemic. And also there's some more information in there about the what we call financial help, right, which are the advanced premium tax credits and cost sharing reductions that most Montanans qualify for when they, the Montanans who enroll through the marketplace qualify for these tools to really help make coverage more affordable and make it more affordable to pay that premium and then make it more affordable to actually go in and see a provider. So heading into open enrollment, Cover Montana, we put together some new resources to really help our neighbors make sense of their options and connect them with care. So here's an example of some of these one-pagers, and they have these we talk a lot about federal poverty levels, which gets pretty wonky sometimes, so it's helpful to kind of see it in a chart. So they are included on these charts, and we will send those out. But I will just one thing to note on these resources we created. So in addition to seeing our overall uninsured rate increase, our uninsured rate among children in Montana has also been growing. This was even before COVID. So we are reminding families this open enrollment period that Healthy Montana Kids is a great option for many folks, right? And with one application on healthcare.gov, you can find out what everyone in your family qualifies for. So maybe the parents are on a marketplace plan and maybe the kids are on Healthy Montana Kids. But with just one application, you can put information for everybody in your house who needs coverage, and it will figure out what each of those individuals qualifies for. So keep that in mind. We really want to make sure that we are addressing both our uninsured rate and also the uninsured rate among children. We'll send that. You can see these are our charts. This is some of the special provisions for Native Americans, looking at your family size and then looking at what your income is per year, and kind of what that 400% on the right side of that is like the 400% of poverty line. But to give you a sense of who qualifies for some of these provisions, and again, these are specific provisions that are for enrolled members of federally recognized tribes. Another chart, I'll skip over that one. And so there are, I think, there are assistors like Laura across Montana, right? We have the contact information for the 4 organizations in Missoula who have enrollment assistors who receive those Safeguard Access Grant dollars to really do this work during this open enrollment period and during the pandemic. But if for some reason you're not in Missoula, if you're in the county, or if you're in kind of any other part of the state of Montana, you can, and hopefully in most places, find local help available. We have a website, covermt.org. If you put your zip code in, you can find somebody locally. We also have a helpline. I will fix that slide, where you can ask questions and then also get a local referral. So one final note, we also want to encourage folks to make sure you're enrolling in a marketplace plan that's eligible for financial help and includes robust consumer protections. If you Google right now, affordable Montana health insurance these days, you can get a lot of confusing information, right? It's a full page of mostly out-of-state folks who are excited to sell you a plan. You can put your information in and they'll call you. But some of these plans are short-term plans that might sound really good on the surface. They might have a nice price tag, but they don't provide the same consumer protections that we need and we've come to expect. Things like the 10 essential health benefits, right? Making sure your plan covers the ways in which we access care, like no pre-existing condition exclusions. So we want to encourage everybody who is interested, who's uninsured, who's underinsured, who's looking at their coverage options, to make sure that you are getting a plan through healthcare.gov. The easiest way to make sure that you're getting a plan in the right place is to talk to one of these certified application counselors, these enrollment assistors who are trained, certified. Their help is free and confidential, and they can walk you through it. Because these days, for example, as we think about the consumer protections that really matter, we are talking a lot about vaccines, right? All marketplace plans cover preventive services, including vaccines, with no out-of-pocket costs. So please make sure you're buying a plan through healthcare.gov. We also remind everybody to get a flu shot. It's free. And then rest assured that these are the kind of protections, and your plan will cover the forthcoming COVID-19 vaccine and help give you the peace of mind in these really unprecedented times. So with that, please don't delay. The deadline is December 15th, and we hope that you get covered. So I will stop sharing slides. And with that, I think we have time for questions if there are questions.
No questions from the media? Okay, well, thank you everyone for joining us. Like Olivia said, we'll send out a follow-up email with some of those slides and a recording of this as well. So thank you all for joining us.
Thank you.
Thank you.
Thanks.
Thanks, everyone.